My name is Maureen Maher. I'm the founder and educational director of the Center for Continuing Education, and I'm the author and an instructor for this particular course. So if you're interested in expanding your practice to focus on women's health and pregnancy, then this online course will be very good for you. So I wanted, first of all, to explain a little bit how this online course is going to work and what is expected of you. For those of you who have perhaps never done an online course before, some of this might be a bit of a learning curve, but I'd like to believe that we've organized this course as much as possible. Our goal is to simulate a live classroom experience. Now, for that reason, we have online learning to do with audio format of me explaining and accompanying each slide or page. And there's homework assignments for you to do at your clinic setting related to each chapter you'll have covered. So if you go through the entire course, each chapter, download the homework assignments, complete them and submit them, and complete the course, you will receive your certificate of completion. Now, homework practice sheets, assessment forms, step-by-step treatment protocols, all of that will be there in the course for you to use and download to practice in your clinic at the end of each chapter we'll have covered. All homework assignments are downloadable forms, which means you need to have access to a printer. So this course has 8 chapters, which means it will run for 8 weeks. You have an additional 2 weeks to submit your homework assignments. But you do also have access to the online course itself to come back and review chapters or review some of the audio. Now, we understand that not everyone will have access to pregnant patients within a specific trimester that we might be addressing in every chapter. But just as in a classroom setting, when an ideal model is not available, we practice on whoever is willing to volunteer. This stepping stone is actually more comfortable for some practitioners, but when you're practicing the initial assessment and some postural assessments that you'll see in the first few chapters, if you're not practicing on a pregnant patient, you might find this exercise to be dull or obsolete. So we do recommend that you try now to start asking around and trying to drum up some pregnant patients to practice on so that your practice and homework experience simulates the real thing as much as possible. I have been treating pregnant patients for over 15 years in various cultures and various settings, so I'd like to believe that I have quite a broad spectrum of experience. I was also trained in Canada through the classic French model of osteopathy, which puts a lot of emphasis on working the connective tissue and taking a longer and more gentle approach to treatment. Continuing education is not just to reinforce what you already learned in school, it's to broaden your horizons and add to your scope of practice. We do try to keep a very high standard for our courses. We're very well known for that, and we're trying to maintain it throughout this process as well.